Thank you all for having us. I greatly appreciate the opportunity to come speak to you guys about EMS. In our traditional role and what you guys know of EMS, but also some of the new programs that EMS here in Manatee County offers. And so this is probably what you guys know of EMS. Lights and sirens are probably the first thing that come to mind when we say emergency medical services. And after that is probably Johnny and Roy, right? Squad 51? No? So, when people think about ambulances, it was an old TV show. They think about lights and sirens, responding to emergencies, those that are critically ill or injured. And in Manatee County, we stay very, very busy doing just that. In 2021, we responded to 53,150 calls. And that is a very, very busy system. Of those 53,000 approximate calls, we transported 33,500 of those people. And we did that with 212 employees and only 21 ambulances on the road. And this is what most community members see as the face of EMS. We also have an average response time of 12 minutes and 6 seconds, which is actually within goals that have been established. So. But in responding to all these calls, back in 2016, our EMS chief, James Crutchfield, also saw the need for some of these people that we encounter on a regular basis. And we encounter the same people over and over again. And so what he did is put together what's called a community paramedicine program. This started with him and him only. And this team has grown significantly to include Sonia, and she'll get a chance to talk about herself here in a little bit. Sure.
So, in Manatee County, we have about a little over 400,000 people. Speaking of insurance, we have 15% of our population is uninsured, which is actually, it seems like not a lot, but I used to work in DC and they had like 4%. And their population was much, much larger. And 10% of our population is living in poverty. And the last point in time count, which counts like the homeless population in one night, is over 1,100 people. So there is a lot of need. This is, I think, one of the things that our Chief Crutchfield was looking at, and seeing that a lot of people were turning to the EMS system to help fill that void and fill those gaps, unfortunately, inappropriately sometimes.
So, given this need, our team has grown significantly since we first started. Our team now consists of medical services, where we have myself and 3 full-time community paramedics and 3 part-time or alternate community paramedics that assist us as well. We've also grown to include a resource coordinator within our program. And then we also have Sonia's side of the house, where we have a licensed clinical social worker that works with us to help us fulfill the needs of our patients. We have a patient healthcare coordinator who works with patients that are enrolled in our county, Good County Insurance program, which Sonia will talk about. And most recently, we added an outreach case manager who works alongside with local law enforcement to meet the needs of the homeless population in an attempt to divert them from chronic homelessness. So what is community paramedicine? This is something that a lot of people are not familiar with. Community paramedicine is a new or emerging healthcare delivery model that increases a patient's access to services, and the people who work as community paramedics are specially trained EMS providers. They're all paramedics. They work in an expanded role to provide care to patients at home in their own environment. And that gives us the opportunity to actually look at the social factors that are affecting their health care. And like I said, you know, all of our community paramedics went through paramedic school, and then they go through additional education to gain certification as a community paramedic. So a lot of their program is focused on providing health education, monitoring chronic illness, those type of things. One really cool thing, there are currently, all of our community paramedics are required to obtain certification as a community paramedic within 1 year of hire into the program. And there are only 492 community paramedics currently worldwide. There are only 9 in the state of Florida, and here in Manatee County, we're really lucky to have 4 of those working for us. And I think that says a lot to the program. So who do we try to target and make an impact on? First of all, they have to reside in Manatee County. They have to be over 18 years of age. And then we target those people who have uncontrolled or poorly managed chronic illness. Diabetes, respiratory illness, cardiovascular disease, hypertension, and also we focus on people who have frequent falls, which can make up a significant amount of our call volume, mental health and substance abuse, and then high system utilization. So we consider high system utilization anybody who uses the hospital or the EMS system more than 3 times in 30 days. Yes, that is a lot. But you'd be surprised the number of people who do utilize the 911 system or the hospital that frequently. And so what do we do whenever we encounter these people? We first of all assist them with establishing care or services. So we work with our community partners and our very, very wide network of organizations to just get them established with services that help fulfill their needs. We also do things like home safety assessments, going through their homes and helping to make sure that their home is safe for them to be living in, preventing them from falling, and it's actually contributes to them having a positive outcome as far as their health. We also do vital sign monitoring and trending, so we take vital signs every time we encounter a patient. And we also have a technology called remote patient monitoring. So we actually deploy equipment into their home, and it actually sends their vital signs to us, so we don't have to be physically there. And it helps us to trend and identify problems without having to be physically there with the patient. We also do some point of care testing, blood specimen collection for people who can't leave their homes. We also do like medication boxes, help them get those set up. And then during COVID, we had a significant amount of people who could not leave their homes. So we took over the homebound COVID-19 vaccination program. But most importantly, and probably the most important intervention that we have is just educating our patients. Our goal is to help people be happy and healthy in their home. And we do that by helping to educate them with the goal of improving their healthcare literacy, helping to empower them to navigate the system on their own. And then we also educate them on their chronic health conditions and their medications.
So back to the uninsured. So like I said, there's 15% of our population's uninsured. And in Manatee County, we're lucky enough to have the Manatee County Healthcare Plan. It also goes by IHS, Good County. There's like so many different names, but it's technically the Manatee County Healthcare Plan. And people that can qualify are people that are uninsured, that don't qualify for Medicare or Medicaid. They're under 200% the poverty level. They have to be a Manatee County resident, and they have to be between the ages of 18 and 64. Latrice is our healthcare patient coordinator, and she provides case management to people that are on the Manatee County Healthcare Plan, and she helps them, educate them on their benefits, and also who can provide with primary care, specialty care, and all the other benefits that goes along with that insurance plan. It covers most anything that's in Manatee Memorial Hospital and also the outpatient services building next to Manatee Memorial. She also helps people, her clients connect with We Care, who provides free specialty care. They're a big partner for us. Angie is our homeless outreach coordinator. Outreach case manager, that's her official title. But she goes out with Deputy Jewett and Deputy Williman from the Manatee County Sheriff's Office, and she does homeless outreach. 2020, we had the point in time count, and it was like 300 people that were homeless in Manatee County, which was impossible because between me and Deputy Jewett, we probably knew 300 homeless people. And so after that, I told all the paramedics, if you run a call on a homeless person, please refer to the community paramedics program. So that way we can kind of get a better idea as to what our homeless population looks like. And we got really involved in the pit count last year, and then we ended up with over 1,100 people. So obviously we were very, very off for 2020. But the homeless population is like 11 times more likely to call 911. So for us to be able to connect with them, sign up for the Manatee County Healthcare Plan, also, educate them on their benefits. Some people already have Medicare, some people already have Medicaid and have no idea, is the best thing that Angie can do for this population. These are just a couple pictures of us doing homeless outreach. I always like the first picture because if you see up in the sky in the tree, there's a man living in the tree. He's like a Keebler elf. Like it just reminds me of that. This man, we were trying to find him for a very long time, and the whole time he was living in this tree. So that population is very, very resourceful, very witty, very, I don't know. I think they're remarkable people, and they're very resilient. So we're just trying to make sure that they know where they can go and they know the resources in the community, so that way if they do decide to come out of homelessness, that they have all the support that they need. Some people want to be homeless, and that's okay, but we, just like Brad says, we want to make sure that we educate them and they are making an informed decision. After about a year of me and Deputy Jewett doing some homeless outreach, Deputy Jewett asked for the HOT program, which is the Homeless Outreach Team program, and the county funded 10 hot beds at the Salvation Army. It started back in March. And so these beds are made for diversion. So if there's anybody that we're trying to do homeless outreach with, and their housing issue is causing instability in other areas in their life, we like to get them to the shelter, have them, kind of a little bit more stable, and try to connect them to resources. A lot of people have medical issues we've seen, and the hotbed program is different than just the overnight program because they don't have to leave. So the overnight program, you have to leave at like 7, I believe, in the morning, and you have to take all your stuff with you. So the hot program makes it a little bit more homey, and you're not so rushed to like grab all your stuff in the morning and leave. You'll have more time to make those connections with the resources that can help you long term. So in like the past, since 2016, we've grown a great deal, and we've had some really great community partners with like the local hospitals, the medical providers, MCR, and like DOH is a huge partner for us. Also the mental health partners, Centerstone, the local the local shelter, the Salvation Army, Suncoast, the Continuum of Care, Suncoast Partnership to End Homelessness is a huge partner as well, because they're the ones that kind of coordinate all of that homeless count and all that stuff, along with turning points and, you know, other homeless assistance programs that help our population. And then of course, our local law enforcement, which we partnered very well with.
So how, if you know of somebody who would benefit from our program, wanted to include our referral information or our process, the first way is there is a paper form you can print out and fax or email to us, and that link is on there. But right below that button to download that form is actually an online referral form. It's actually the preferred method. It's very simple, just ask some demographic information and what type of issues the patient is experiencing, so we know how we can best help them. You can also, if you don't have access to the internet, just call our office. We'd be more than happy to take a referral over the phone as well. There is our contact information, emails, as well as work cell phones. If you guys have any questions, we'd be more than happy to answer them. We'll go with you first, I guess.
What are the prerequisites to be a community paramedic?
She asked what the prerequisites were to become a community paramedic, and in order to become a paramedic, you have to first of all be an EMT. So an EMT usually goes through about 150 hours of just training. It's usually a 3-month process, one that Sonia gets to experience soon. And then after that, they have to go through a paramedic program course. Usually consists of an additional 3 college semesters. It's 1,200 hours of additional education and clinical experience. And then after that, they have to be a field provider for no less than a year before they can begin the community paramedic education. Yes, ma'am. Ladies first, I'm sorry.
Sure. Of course, absolutely.
Hi, my name is Pat. I have obviously a communication disorder. It's called spasmodic dysfunction. There are other people like my mom who had a stroke that had a patient. Traumatic brain injury, Parkinson's, and so I would like you to address how you deal with us, because I've had more than once a difficult time calling 911. They don't understand me. They said they can't find my street. It's just it's easier for me to drive myself to the hospital than to deal with you guys.
Yeah, that could certainly be frustrating, absolutely. Was everybody able to hear her question? She wanted to know how we might be able to handle somebody with aphasia or a speech difficulty. And so I think that's multifaceted, whether we're talking about the 911 response or the EMS response, or from the community paramedic side. So I'll start with 911, first of all. Anybody in this room can text 911 from their phone. So if you are having difficulty speaking, you can actually send a text message to the number 911, and that will be answered. Another great option, yeah, even if your cell phone doesn't have active service, so long as it has power, you can send that text message. So that's one way that you could do that, because as long as you're able to type that message out, right? Another option would be something like a medical alert device, like a button. And using something like that, if you press the button and they know your, the company, whoever you go through, will know your location, of course. If you don't say anything, you don't have to say anything, they will dispatch an ambulance.
There's also 711 relay system. But by the time I get done saying something, and they repeat it back to you.
But the great thing about that button is you don't have to say anything. If you don't answer, they're gonna assume something bad happened to you, and they will have somebody there. As far as the addressing issues, we have computer-aided dispatch. There's maps within the vehicles. Actually, it just got upgraded probably about 2 months ago, I believe. And if you're having issues with your particular address, I would encourage you to reach out to the mapping department, because they're the ones that put, or I guess associate your address with a GPS location. As far as EMS or community paramedicine, the best thing that we can do to, help you with your aphasia or help to understand you is just a lot of patience, right? And sometimes with frustration or a sense of urgency in an emergency, that can be a little difficult, but just slowing down and being patient is probably one of the best tools in that situation. Sonia and I are both working with a patient right now who has significant aphasia. And just through our encounters with him, I can start to, I've learned the way he speaks, so I can now pick up on, what he's saying. So it can certainly be frustrating, but I think just patience and then some of those other tools can certainly help.
2 things I want you to know, that I'll be quiet. Actually, it's not an anxiety issue. My voice sounds like this no matter what's going on. That's important. And number 2, it's not a lung issue. I'm having trouble breathing because my voice,
Your vocal cords, yeah.
vocal cords are closed. I can't get air in or out of my lungs. And paramedics insist on putting me on oxygen. It doesn't do me good.
Yeah, and
So take that time.
yeah, absolutely. And I believe that we had some education that was sent out to crews about either your particular condition or a similar condition. And that was done quite a while ago, if I remember correctly. I would say maybe 6 months ago. It's impossible to know every single medical condition, unfortunately. But one of the things that we can do is we just have to be compassionate, and take our time. We're not gonna know everything, so, even if we do put you on oxygen, it's just out of a concern. It's may not be the right treatment, but it's also not the wrong one either. It's not gonna hurt anyways, right? So it's just, they're doing it out of a concern, so.
Thank you.
Absolutely.
Obviously, I saw several hands, but in the interest of continuing to move things, Chris, I think you had a question. Would you like to direct?
Yeah, just a quick one. When you get a 911 call from somebody who's a frequent caller, do they automatically get kicked over to the community paramedicine program, or is that 911 call handled like anywhere? Or do you have to sign a paper in order to have community paramedicine kick in?
So, we do not get dispatched at the time of 911 call. We treat every 911 call as if it's an emergency. So there will always be the same ambulance or fire response, law enforcement, no matter what. What happens is that crew will then, within their documentation, they have a button they can click. We get a report the next day that says, hey, you should check on this person.
I see.
So we monitor the usage, and then, you asked about the consent.
Yeah.
It's a voluntary program. We can't force anybody to participate, but what we can do is go out and explain that our goal is to help them. Either they're calling because there's, there's a need that's not being met. We can connect them with resources and explain that the goal is to keep them in their home, happy, healthy, and explain that we would like to help them in that process. And then we get them to sign, consent forms.
But you don't go out for the initial 911 emergency. You get the notification from the 911 folks who are out there that there's somebody that you're familiar with.
Correct, yeah.
Gotcha.
It's rare sometimes when like,
Occasionally.
yeah, occasionally we do, if we think, oh, there's Bobby, he called again, or, whatever. Especially Ashley, if you're like really good at it. She's like, oh, I know that address, and she'll just head on over along with an ambulance. So that way, maybe she could divert, and she could say, oh, you need to, sorry, I'm not a paramedic, I won't talk about that,
Do you
but.
ever have anybody who you educate on this who doesn't sign the paper and doesn't enroll?
Yeah, so we have about, last time I checked, I believe it was like 18% of people just don't want help.
So you'll keep getting the calls from them?
Yeah.
Okay.
And we will check up on them
Sure.
from time to time, so.
Thank you.
I know there are other questions, but Brad and Sonia will be available during the break, because what I am going to say right now is, first of all, we want to thank both of them.